And now, an exclusive sneak preview of a recent X-Talks webinar, Amorphous Solid Dispersion, an ideal formulation approach to improve developability of poorly soluble molecules.
In a typical NCE development phases, the main challenges or issues observed which causes the drugs not terminated or not developed further is mainly because of poor aqueous solubility, which results in a poor bioavailability and poor physical and chemical stability of the drug molecule itself, low permeability, first pass metabolism, and very short half-life, which limits its duration of action in the systemic circulation. So as you can see this from the literature, so drug discovery is a time-consuming and very expensive process. It starts with thousands of compounds being screened to hit the targets and eventually ends up into one FDA-approved drug over a period of 10 to 12 years' time. So any improvement, even by small improvement of developability of even one more molecules may result into, say, 2 FDA-approved drugs, which is tremendous improvement compared to success rate just by one more molecule. So this is that slide which shows the typical reasons for drug failures in the industry. So there are several reasons. Mainly the top 2 reasons are poor PK and ADME profile and lack of efficacy. Efficacy is more related to structure molecule itself. The second, the major reason of attrition is a poor PK ADME profile, which also includes permeability issues. But the solubility issues can be addressed through right selection of right formulation approach. So this today's topic is mainly about how do we improve that and discuss about one of the major technique which is employed for more than 2/3 of the compounds in the industry. Use amorphous solid dispersion as a way to improve exposure, enable tox studies and clinical studies. So that these are the typical approaches, novel drug delivery approaches employed to address the solubility, bioavailability challenges. And the top choice typically is amorphous solid dispersion, which is mainly the converting the crystalline drug substance with very low solubility into an amorphous drug and embedded into a polymer matrix to stabilize it. And this is widely employed and majority of compounds, and it works for any type of compounds without limitation. And the second approach is a lipid-based microemulsion formulation suitable for highly lipophilic compounds and also very highly organic content in terms of oils, surfactants, and solvents, which are not quite safe compared to the hydrophilic polymers we use in solid dispersion. And a nanosuspension where the drug is still in a crystalline state with a particle size reduction to the nano size, increasing the surface area by several folds in a way to improve the dissolution. It doesn't improve the solubility as such, but it could be a good approach for certain kind of molecules. So today's topic mainly focused on amorphous solid dispersion, its key aspects of development and its challenges and its advantages and limitations, etc. So the overview of amorphous solid dispersion. So ASD is a dispersion of one or multiple drugs into an inert hydrophilic or water-soluble polymer at a molecular level in solid state. And the basic principle involves converting a crystalline drug, which is poorly soluble, into an amorphous form and stabilizing in a polymer at an appropriate drug load. And when this solid dispersion powder, or which is converted into a capsule or tablet, when this is exposed into an aqueous media in GI tract, the carrier dissolves first and the drug releases as a fine colloidal particles, still in amorphous state, forming a very high surface area, increasing the dissolution rate, upper end dissolution rate rapidly, and the polymer surrounded by polymer solution, which actually prevents the crystallization or precipitation of the drug, thereby improving the bioavailability. for the duration of. So how the extent of supersaturation and inhibition of precipitation determines the how much improvement in the bioavailability can be achieved in the in vivo. And it's estimated that over the years that more than around 40 to 70% of NCEs are fully water soluble. And within these, the majority of compounds are amenable to amorphous solid dispersion compared to other novel techniques. So this becomes a very critical technology which can help improve the developability of several molecules. So the advantages, coming to advantages of amorphous solid dispersion, its main advantage, it improves the drug solubility or dissolution compared to a crystalline drug, and thereby bioavailability and in vivo exposure. The vehicles used here are quite safe, the hydrophilic polymers, and a very small percentage of surfactants compared to the other liquid formulations. And improved wettability dissolution, and the drug is in amorphous state, stabilized in a polymer, and a very high degree of porosity.
To view the entirety of this webinar, visit the link in the description and register on xtalks.com completely free of charge.